Okay, the trauma patient just arrived and he was in a car accident and he is complaining of neck pain. He's wearing a C collar, so the doctor wants to clear it out. And we're going to be taking 3 exams, lateral, swimmers, and an AP axial. So what we're going to do first, can I get your first and last names?
Jim Carrey.
Okay, date of birth?
August 19, 2000.
Okay. I'm just going to be taking your x-rays, okay? I'm going to put this shield over you. And I'm going to use a pillow right here and some sheets to hold my IR. I'm going to try to center it at C4. I'm going to place a left marker. Okay. I am going to be using the portable, and I'm going to try to have a 72 SID horizontal view, and it's going to be entering at C4 at the MCP, and you're able to tell where the C4 is at because of the Adam's apples. So if you can relax down your shoulders, good. Okay. I'll be using a 75 at 14 technique for him. I'm going to make sure everybody is clear, and I'm going to have you, and also I'm going to have you breathe in and let it out. Let it out and hold it, and then I'll expose. Okay. We're going to come over here, and we're going to look at the image, and right here it's demonstrating C1 through C7. And also the cygal joints are superimposed. There's intervertebral disc space, and we could also see the mandibular rami over here on the side, which is not overlapping on C1 and C2. And the doctor says this image, he's clear, and the nurse will take off the C collar so we could continue to the swimmers. Okay. So now what I'm going to have you do is raise this hand up, okay, all the way up, and then I'm just going to bring down the IR a little bit, and I'm going to try to center it at C7, and then bring this one down. There you go. Okay, and you're able to tell where C7 is at because of the clavicle right here. You could use that, and try to keep straight your head. There you go. Look up. Okay. And then right here, we're going to be using a 40-inch SID, the horizontal beam. And as I said, it's going to be entering right here at C7. Then I will make sure, again, everybody's clear, and have you hold your breath and expose.
The technique I'll use is 90 at 45.
Come over here and look at the images, and right here the image is demonstrating C7 and T1, and that's what we're trying to look at. Also the humeral, the head of the humerus is over here on top, so it's out of the way of the vertebral, and the clavicle is depressed, so the image is good. Now we can continue with the AP axial. So for this one now, you could bring down your arm. And I'm going to put this IR under you. Are you able to lift up your head, or do you need help? Okay. Okay, I'm going to put my left marker again on the left side. Have you just relax. Chin up a little bit. Right there. And then for this one, we're going to be using, we're going to have the IR perpendicular. No, we're going to have the IR angled 15 degrees cephalic. And it's going to be entering right here at C4 where the Adam's apple's at. And also at the MSP. I'll be using 75 at 12 and a 40-inch SID. So the beam will be angled like that. Also, make sure everybody's clear. And have you, don't move. Have you hold your breath and expose. Okay. You can relax and breathe. Now we're going to come over here and look at the image. We're able to see C3 to T2, around T2. So also we could see the intervertebral disc space on the image. So this is a good image. Okay. Okay, so he's all done. I'm going to take this away from you. And I'm going to take this, Ira, if you can lift your head up a little bit. Okay. So we're all done with him. And the trauma team is going to keep working at him. So I'm going to come over here, clean my portable, and wash my hands and send my images. Okay. And that is it.